Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, as you know, I have provided almost all the topics in a very systematic order, and this is quite convenient for the continuous study, and definitely you can make use of it. My dear friends, we have been discussing about challenges in administration of medicine in children, especially Ayurveda medicines. In that context, we have been discussing about Bahya Chikitsas, and today we will have the continued portion of the same. One more very important and effective Bahya Chikitsa in childhood practice is Avagaha Chikitsa. Now, Avagaha Chikitsa means where you have to prepare the kashaya of so many medications or so many medicines, raw medicines, and then that kashaya would have been kept in or should be kept in a tub bath like vessel, tub bath, or maybe a wide mouthed vessel, and where child may be able to sit inside, or if only localized avagaha you want to give, it may be to the both the foot and as well as the palms and hands, etc. The question is, when you go for this avagaha chikitsa where child is made to sit inside that khada or kashaya, usually child used to enjoy that. Okay, so that is one of the benefit of this Avagaha Chikitsa, which makes our treatment quite easier. Now, suppose certain dry conditions related to the skin. There may be ichthyosis, or there may be some psoriatic like lesions, ichthyosis, or many other dry conditions, or the thickenings, lichenifications like conditions. Wherever there is a dry condition, dry and thick conditions are there, Avagaha, which is prepared by the drugs of Madhura, Shita and Snigdha Guna, is very, very effective. So, Avagaha, which is prepared by the powder or whatever, the twak or bark mula of Dasha Mula, Bala Mula Kashaya and Aragvada Kashaya. So, this is quite beneficial in case of skin conditions related to the dry. Similarly, what we have to do is we have to prepare the kvata of all these drugs, fill it in the tub with the lukewarm, and make the child to sit in that tub for 30 minutes with the by filling the kashaya up to the neck portion of the child. If the child is too young, that means maybe 1 year or 2 year, he should be little careful when he is sitting, and parents should assist him. And if the child is 3 year or 4 year old, definitely he will going to enjoy it. Similarly, one more important avagaha which can be done is that is Gomutra avagaha. Gomutra avagaha is very, very effective, and it will going to give the benefits of shodhana of the shrotas, and quite beneficial in ichthyosis, congenital ichthyosis like condition. And so similarly, some other kashayas can be also given with the beneficial effect depending upon the condition of the patient. Now, one more important thing is we have to discuss about the multiple role of Yasti Madhu in pediatrics. Yasti Madhu is one of the mother rasa drugs, quite easy to give in children. So now we have to make use of this Yasti Madhu for multiple conditions. Number one is Yasti Madhu is quite good in dry cough because it is kapha vardaka and as well as kapha chedaka. So therefore, in dry cough, this is quite beneficial. Initially, when there is no formation of the sputum, then there is no formation of the sputum. So then this particular Yasti Madhu will going to increase the sputum, and that going to increase the sputum and make the expectoration quite easier. Similarly, in the productive cough, it has got good effect because productive cough, it has got the kapha chedaka properties. Otherwise, also it will go into excoriate the cough out, sputum out. One more thing is Yasti Madhu is also mild vamanopaga. So there are certain conditions where kaphaja conditions are there, but you cannot induce the vamana. There you can go for vamanopaga drugs like in the form of Yasti Madhu. For example, there is too much of collection of the kapha in the chest area or kapha purna koshtata, etc. like conditions where instead of going for actual vamana, you can go for vamanopaga drug, and best drug is Yasti Madhu. Yasti Madhu is also quite good in some of the speech problems because Yasti Madhu has been referred as Kantya. So certain speech conditions also, maybe stuttering or stammering like conditions, it can be mixed with Vacha and Manjishta and given for licking. Or you can also go for Jivha Pratisarana, which is also quite beneficial. Yasti Madhu is also good for change in the phonicity of the voice. It is Kantya as I told earlier, so therefore any change in the phonicity of the voice, there also you can go for Yasti Madhu. Otherwise, Yasti Madhu is a known drug for Medhya Rasayana. Kshirena Yasti Madhukasya Churnam. So it is also a Medhya Rasayana. So to induce the Medhya effect in children also, you can go for Yasti Madhu, which is also called as Jeshta Madhu. It's also called as Ati Madhura. Now, Yasti Madhu is quite good in case of fungal infections, especially fungal infection of the face, scalp, and other parts of the body. It is quite beneficial, and Yasti Madhu Taila, or is very very beneficial in all the skin conditions with the hypo or hyperpigmentation, and even very common fungal infections like teniasis and pityriasis alba, etc. Further, Yasti Madhu has been mentioned as best Rasayana also. So Yasti Madhu Rasayana is also available in the market. So Yasti Madhu Rasayana is also very good, and it is also a Vayastapana drug. It is also the Vayastapana drug. So therefore, it is quite good. Yasti Madhu is also a very good immunomodulator. Now Yasti Madhu also has got positive effects on increasing the body immunity because it is an immunomodulator drug. It has been mentioned under the Vayastapana drug, and therefore it is also a very good in inducing the regeneration of the body. Any degenerative conditions of the body which requires a immunomodulator and as well as the Rasayana effect, so you can go for Yasti Madhu. And further, Yasti Madhu Tela is very useful in typical skin infection like scaling and dry skin, etc. One more is Yasti Madhu is also good in certain GIT disturbances, especially related to hyperacidity, or what we say acid dyspepsia disorders. Now, gastritis like conditions where there is sore eructation is there, Yasti Madhu is Madhur Rasa, so that it will going to normalize the Pitta. Therefore, Yasti Madhu is quite good. And Yasti Madhu is very good, as I told, in hypo and hyperpigmentation, as it is mentioned as Varnya property. It is also Varnya, it is also Kantya, it is also Rasana. So therefore, a simple Yasti Madhu, which is actually Madura in taste, which is well taken by the children, accepted by the children, can be used for multiple purposes. It is good in autoimmune disorder, it is good in gastritis, it is good in degenerative condition, it is a very good Vayastapana, it is very good in skin conditions, okay, and sometimes it is very very good as a Vamanopaga drug also. In the next class, we will discuss about the multiple role of Ashwagandha, Vidarigandha and Shadavari in childhood practice. Thank you very much.